Hi, my beauties. My name is Dr. Stefani Kappel, and I'm a board-certified, fellowship-trained cosmetic dermatologist and laser specialist in Newport Beach, California. And today I wanted to do a video taking a little deeper dive into lasers. Now, last week I posted a video on lasers, and you guys had so many amazing questions and comments asking me to take a deeper dive into lasers and had so many insightful questions. And lasers, I think, just in general, are just a very overwhelming topic. When you're online searching what kind of laser you should get, or what laser would be right for your skin type, or what dermatologic condition or skin ailment you want to correct with a laser, how do you find the right laser? And I'm not going to cover all of that because that video would be like 8 hours long, but hopefully I can do little videos here and there, kind of taking a deeper dive into questions that I see popping up in my comment section in my video. So before I move on, as always, I ask that you like, subscribe, and share this channel with anyone who wants non-sponsored content by a board-certified dermatologist. I've never been sponsored. You'll find no coupon codes on my site. I never have and I never will, and I'll stay true to that. So anything that I talk about today, even with lasers or different devices or energy-based devices, is non-sponsored and just what I truly feel is best for my patients and the honest truth about a lot of these companies, because I'm not tied into any contracts, so I can just speak freely and let you know my opinion based on years of education and training in this industry. So in my last video, I talked about lasers that are used for tattoo removal, laser hair removal, and then lasers that we have in our office that are used to make the skin look better. And that's like this pico laser behind me. Lasers that are used in cosmetic dermatology for those applications are different more times than not than the lasers that we use for hair and tattoo removal. So this isn't a hair removal and a tattoo removal laser video. This is more just for cosmetics. And I wanted to kind of break it down a little bit more for you guys, but again, I can't do a whole comprehensive laser video because that would be like a 10-hour video. But let me know in the comment section what in particular you want to hear about. But I think that what happens is when people are looking online and looking for a laser treatment, they can be thrown off by the names. So you have halo and pixel and tixel and fraxel and erbium and CO2 and CO2 core, and there's so many different kinds. So you just have to break it down into what laser you need to achieve a certain skin goal. Is that just an overall rejuvenation, for texture, meaning like, reversal of acne scars, fine lines and wrinkles? Or is it a laser that you want to, decrease redness or rosacea, or actually get those little pesky broken capillaries on the face? Or is this a laser that you want for hyperpigmentation or removal of brown spots, which in darker skin tones, you have to be careful what laser you select, because there's certain lasers that are engineered just to help, treat melanin or hyperpigmentation. And so there's some lasers that I always say are a jack of all trades, master of none. We'll do a little bit of everything, but there's also lasers that are targeted to different ailments. And when you customize each laser treatment and combine laser treatments to make the skin look and appear better, the results are next level. And what I mean by that is if someone comes in, you have to take it into account, into consideration, a patient's skin tone, the type of skin that they have, what they're trying to achieve, and what bothers them. Is it brown spots? Is it red spots? Is it large pores? Is it fine lines? Is it wrinkles? Is it acne scars? Is it under eye wrinkles? And then you can kind of customize and combine different treatments based on what their needs are and what you're trying to achieve. So the lasers that I have in my office are all for rejuvenation and overall cosmetic dermatology. And that's my area of expertise and that's my specialty. So I always have to tell patients, don't get overwhelmed by the names of the lasers, because there's certain lasers that are in a certain category. For example, for resurfacing lasers to treat fine lines, wrinkles, acne scars, you have the resurfacing lasers that can be ablative or non-ablative. Don't worry about if it's a halo or a tixel or a pixel or a fraxel restore or a fraxel repair or an erbium or a CO2. There's different levels of aggressiveness of these lasers, meaning like the more powerful lasers may have more of a result, but also have more downtime. So these different laser companies have different options and different platforms that are engineered to fix a specific problem, but they can vary by the amount of downtime that a patient will have after the treatment, the level of results that the patient will have, the number of treatments that a patient will need. For example, for the more powerful lasers, you'll maybe get more of a response, but with that comes, more downtime, and the benefit is usually less treatments are needed. The flip is also true. So if you have someone who comes in with, very little downtime, a very busy social calendar, they want to take little successive of approximations to their goal and not have a lot of downtime, but are willing to have more treatments with the less powerful laser, that's an option too. So that's, you know, like when you're talking about a clear and brilliant or a more superficial laser, that's, you know, kind of the category that you have to think of. And then when you talk about lasers for hyperpigmentation or brown spots or melasma, you know, you can either look at the wavelength, like, you know, a 755 or a 1064 nanometer, 532 nanometer, but that can be overwhelming also. So I always say just, you know, think of lasers as what wavelength they are and what they're trying to achieve. And then you can get lost in the names, because when you just look at the names of lasers, I just see it when I have patients asking me questions, and I see it in your comments on my YouTube channel. Patients will say, well, what's the difference between a V-beam and a Fraxel? Well, those are two totally different categories of lasers. V-beam is in the same space as like an XLV or a KTP. When looking at the wavelength, they're 595 nanometer wavelength lasers, they're 532. They treat redness, and they're good at treating redness. Now that's different than a laser that's going to treat acne scars, fine lines, and wrinkles, which is also different than a laser that's going to treat melanin or brown spots. That's going to be like a 1064 or, you know, a 755 or a Q-switched. All these lasers, I think when you're looking at it, don't look at the name, just look at, okay, what does my skin have that I want to fix? Is it brown spots? Is it a little bit of everything? Is it red spots? Is it fine lines? And then you can kind of look up the laser, and then from that you can kind of say, okay, I need this category of a laser. I need a resurfacing laser, or I need a hyperpigmentation laser, I need a redness laser. And then you can kind of look into the names, because it can be very overwhelming, because I feel that online everything's kind of blended together in this huge melting pot when they're very different devices that do very different things. So I think if you can kind of think of it that way, it will keep things more clear, and it won't be so overwhelming when you're doing like a Google search for what laser will be best for you. Maybe search best lasers for brown spots, and then just kind of see what comes up, instead of saying, ooh, I see an advertisement for halo, and is a halo right for me? Go with what you're trying to treat first, and then find lasers that fall within that category. That's my best advice. And then find, you know, a laser specialist or a laser surgeon who really understands lasers to help guide you with what treatment would be best for you. And don't be afraid to get a second or third opinion, because you guys, it is your face, and it is like the Wild West out there. There's a lot of self-proclaimed experts, but, you know, they can really cause harm or not achieve the results that you want, or even cause scarring if these lasers aren't performed optimally, safely, and effectively. So after my last video also, I posted on my Instagram, hey, what do you guys want to hear about? What should I talk about? And I had a lot of amazing questions and comments and suggestions, but there were two that struck out definitely more than others to me, because these are repeated questions that a lot of people were asking. The first one was, do energy-based devices or lasers cause fat loss or fat atrophy? And that's a great question, and a question that I get asked all the time. Not even in my patients, even today in clinic, when I finished seeing my patients today, I had several people just ask me today, well, doctor, I want to have this laser, or I want to have this tightening device, but is it going to melt my fat? This is the truth, and this is the deal with fat, you know, atrophy and volume loss with devices. So lasers that we use for cosmetics, like a Fraxel or a CO2 resurfacing lasers, have no impact on the fat. It won't affect the fat. Lasers are collimated light in a coherent wavelength. They don't reach deep enough to affect the fat. So don't worry about that. But I think the problem is that people often interchangeably use lasers and energy-based devices, and they'll call like thermage a laser, or they'll call ultherapy a laser, and they kind of confuse the two. So lasers don't cause fat loss, fat atrophy. It's not a risk with those devices that are light devices. Laser, light amplification by stimulated emission of radiation. That's what a laser is. Don't worry about fat loss with lasers, Fraxel, any device that is collimated light in a coherent wavelength. It doesn't go deep enough. It doesn't go into the fat. Now there's fat ablative lasers, but those are different than the ones that we use in aesthetics and cosmetic dermatology. So I think the problem with that, when people are asking me, do lasers cause fat loss? No, but energy-based devices can cause fat loss when it's in the hands of an unskilled provider, and when it's not being done appropriately, or if there is an older platform being used. So this is the deal with fat loss with energy-based devices, not lasers, energy-based devices. And again, to delineate the two, energy-based devices don't use light like lasers do, photons. They use energy in the form of radio frequency, monopolar radio frequency, bipolar radio frequency, ultrasound, microfocused ultrasound, HIFU. All those are energy-based devices, not lasers. So keep those separate. Energy-based devices, when done incorrectly in the hands of an unskilled provider or with an older platform, can cause atrophy. But again, in my almost 20 years of practice in cosmetic dermatology and as a laser surgeon, I have never had that side effect. I've never seen that happen. So knock on wood. But because I've had the training and understand the way that these devices perform, I understand it on a different level than someone who may took a 3-hour course. I'm talking 15 years of school that really, has given me the advantage of being a laser and device specialist, because not only do I understand how the mechanism of action of how these devices work, but I also understand how the skin responds and what not to do. And you just learn this through years and years of education and schooling. But the problem is that if you're seeing someone who doesn't have the education and knowledge, they're not going to know any better, and they're going to put patients at risk sometimes for fat atrophy. So when in the hands of a skilled provider, fat atrophy shouldn't happen. With the newer device platforms, fat atrophy shouldn't happen. And when I say fat atrophy, I mean loss of the fat pads or loss of volume, because I feel like everybody's paranoid about that, and rightfully so, because that can happen and it has been reported. So to kind of educate you guys and understand how that happens, when you are putting heat in the form of either radio frequency or microfocused ultrasound, some source of energy, which is why we call them energy-based devices, when you put heat into the skin, it stimulates the fibroblasts, the collagen-producing cells, to make collagen, which we use to our advantage to lift, tighten, and pull the skin. So here's the window that you need to be in for the temperature range that's going to induce your fibroblasts to make collagen, that's going to induce your skin cells to make all that volume, extracellular matrix proteins that helps give a youthful appearance to the skin. Now, if you go above that temperature, then you're getting into fat melting territory, which you do not want to be in. You don't want to be up here. You want to be down here, and there's a certain range. And when you're doing these procedures, you can monitor your impedance, you can monitor the energy, you can monitor how many number of pulses that you've had, you heat stack, your vectors. And so if you don't have an appreciation for that, or you don't really have the level of understanding and training, you're going to say, oh, well, more is more, and let's just crank this up. And if it stimulates collagen at this temperature, let's just achieve a temperature way up here, and let's numb the patient so they can't feel it. They don't feel any pain, and we can just go to town and crank it up, and we're going to have even more tightening. Well, that's just not how it works. First of all, any provider that makes you numb for an energy-based device, run out the door, because that's not following protocol. We learn not only from the company, but also in our education, that you don't want to numb a patient who's having an energy-based device treatment, because you want that biofeedback from the patient. If a patient is having a temperature that's too high, it's going to hurt, and they're going to know it, and they'll be like, okay, doctor, that's way too much. Then you turn it down, then you take a break, then you move to a different area. You don't keep going over and over again in that area. And that's what providers who numb their patients do. It's a huge no-no to use topical numbing cream, nerve blocks, any form of anesthesia, even analgesic medication, Norco, Advil, ibuprofen. You don't want the patient to have any decrease in their biofeedback, because if it's too high, those temperatures are getting too high, you want to say, hey, it's too high, turn that down. And then the provider should always be constantly adjusting how they're delivering that heat and energy into the skin. And so that's where the level of expertise comes in. But when patients are numb and they're having fat melting temperatures applied to their skin, and their provider's just kind of going along and just cranking it up, and the patient's numb so they can't tell the difference, that's when you get into trouble. So that's the number one thing I wanted to share with you guys. And knowledge is power, and I want to empower you guys so that you know this going into a treatment, or when you're finding a provider, what to kind of look out for, what the red flags are. The other thing is that I'm going to talk about thermage, because I have a thermage device, and out of all the energy-based device treatments, I feel that thermage has the best results, the most consistent results, happiest patients, and only one treatment's needed, unlike some of the other energy-based devices that are on the market today. So that said, when you're having, for example, a thermage treatment, the FLX platform, which is their most updated software, the most updated platform, of course it's more expensive because it's the most updated and the most innovative. those new platforms turn off automatically when you get to temperatures too high, which is protective for the patient. I think the company probably caught on that people who had no idea what they were doing, they were cranking it on and melting fat, so they're like, okay, let's make the device smarter than the provider, and it's gonna automatically turn off so that you can't have fat melting temperatures. So the problem is that sometimes med spas or offices buy used devices or used lasers because they're cheaper. They're a lot less expensive than when you buy it directly from the company. Most board certified dermatologists or fellowship trained laser specialists only buy the newest devices straight from the company because you know they haven't been messed with. And when a new updated software or platform comes along, you get the new one. That's how I am. All the lasers in my office are updated and the latest and greatest in the industry. When something new gets updated or something newer comes along, we always update our devices. Now, when you're trying to cut corners or you're in a med spa that just wants to start making money fast, it's a lucrative industry. Let's just buy a used laser from a laser broker, and let's just go to town. If you're getting a treatment from an outdated laser or device, for example, for thermage, if your provider's not using an FLX handpiece or the most updated software, then you may be at risk for fat atrophy, which is true. And it's so funny because even at my office, I get inundated every week with laser brokers, used laser salespeople saying, hey, do you want to sell your laser? They'll buy it from me and they want to sell it to a med spa for a cheaper cost. But it's just something, it's just about cutting corners, you guys. And I don't do that in my office. And when these laser brokers want to buy my devices, I don't sell them. What happens is when I want a new laser, I basically will give it back to the company in exchange for the newer platform. You usually have to pay a lot more for it, but hey, it's results and it's the most updated devices and energy-based devices that we provide for our patients, and you can't put a price on that. I mean, it's the integrity and the quality that matters. So just make sure that your provider's not using an old, outdated platform that they bought used from some third-party laser company. You want to buy it directly from the company and have the most updated software because they have protective mechanisms in them to help prevent some of these bad side effects from happening. So again, to reiterate, no numbing, make sure your provider is highly trained, and make sure that they're not using an old used laser. And even ask them, did you buy this device directly from the company, or did you get it as a cheaper alternative knockoff from a laser broker? Because you'd be surprised. They swap out parts, they change the software, and you can really hurt someone if you're using an old or used device on a patient. That was the first question that I got that was the most number one question. Second question that I got a lot that I wanted to kind of include in this video was microcoring and EllaCore. So EllaCore, for those of you who don't know, is the newest and latest technology in skin tightening. And it's not an energy-based device, it's not a laser. It basically tightens the skin by doing microcores of skin removal. So you're removing tiny little pieces of skin. I've done videos on this in the past if you wanted to reference those. I'm about to do a new updated video because we're getting amazing results with EllaCore, and I want to show you guys my before and afters and tell you what my experience has been with this amazing device. But somebody asked me this insightful question, and then a couple other people asked me the same question the week later, and that was, if you're not getting the microcores of skin out during microcoring, then it's just like microneedling, and is it even doing anything? So for those of you who follow me, I'm not the hugest microneedling fan because I feel like the results are very underwhelming. Patients usually get wrapped up into a package and they have to do a second and third treatment, not because they're getting great results, but because they got roped into some package. I'm not a huge microneedling device, and it also can cause side effects and scarring and hyperpigmentation, and I'm not going to go into it right now, but I feel like lasers and energy-based devices are just such a better value for your money, and with long-lasting results that don't lie. And that draws an important point to an important topic. The way that EllaCore works, or the microcoring devices work, is they basically take thousands of little punch biopsies, which are these little cylindrical shaped kind of columns of skin, and they excise it. Now, there's a device that pokes little holes in the skin, and it's attached to a vacuum that sucks those little cores out. Now, what happens is when we do an EllaCore treatment, it all depends on how you're coming in contact with the handpiece of the device to the skin, making sure there's a full thickness seal vacuum, and you want to make sure that you're microcoring those pieces of skin out and that it's getting taken away. Because if these cores are microcored and they just stay in the skin, you're not shrink wrapping those holes. You're not, closing down those holes and shrink wrapping and tightening the skin. You're just basically microneedling, which I'm not that big of a fan of. So that's very operator dependent and has to do with the settings on the device, the contact that the device handpiece has with the skin, the seal of the vacuum. And when my amazing nurse and I do the microcoring treatments, she assists me, she holds the skin down, we have it down, and I have a lot of experience with this device. We see the microcores that are in the skin after we finish a pass with the device, meaning you look at the skin and you can actually see the little holes in the skin. Now, I feel that sometimes there is an issue with providers using EllaCore or doing microcoring where they're just microcoring the skin, but they're not taking those cores out. So you're not essentially shrink wrapping that skin. You're not removing any skin. You're basically just microneedling. And that was a good point and a good topic that somebody asked me. If you're not taking the microcores out, if you're not doing the procedure properly and the vacuum's not taking that skin out, it's not really doing as much. It's pretty much just like a, I would think that it's pretty much just like a microneedling treatment. Now the data says no, and the data says even if those microcores of skin don't get excised or sucked out of the skin, it's still gonna give you amazing results. But I would tend to think, just from what I know about science, technology, lasers in the skin and devices, that without taking those actual cores of skin out, you're not gonna have as impactful as a result as if you make sure that all those microcores are taken out and vacuumed and suctioned out of the skin. So I hope that helps. That's just my opinion, but whenever we treat a patient with EllaCore, we always look at the skin and make sure that all those little microcores have been taken out, and we're not just like passively doing the device and not getting the results, because that's something you do have to look out for, and that was a very smart question. So I hope that answers your questions, and drop a comment in the comment section and let me know what else you guys want to hear about. I love all of your insightful and super smart questions, and I'm here to just be a voice of honesty, truth, and just, honesty and truth and information that can help you guys guide your way to the most impactful cosmetic procedures that would be the best for you. All right, you guys, thank you so much.